evening, everyone. This is Pallavi Raj, your Mrs. Houston Universe 2025. And welcome to this very special My Dream TV's roundtable discussion titled Empowering Beauty Inside the Science of Modern Skincare. I'm truly honored to be joined by a phenomenal woman in the world of aesthetic medicine, Dr. Sunita Patel, founder of Millennium Skin and Laser. It's a premier med spa based out of Clifton, New Jersey, that's transforming lives one laser treatment at a time. Also with us are five remarkable pageant sisters from all across the US, each passionate about wellness, confidence, and redefining what it means to feel beautiful inside and out. So let's dive in. Dr. Patel, thank you so much for being here. Can you tell us a little bit about what exactly inspired you to create Millennium Med Spa and how your journey in healthcare led to medical aesthetics?
Hi, Pallavi. Thank you for asking beautiful question. So my inspiration is behind my creating Millennium Skin and Laser is my deep passion. I empowering individual women to feel that confidence and make them comfortable on their own skin. My extensive experience of medical in a healthcare field that brings a lot of caring and safety to creating the medical, aesthetic medical spa that helps me to take care on safer way, blending science and art together that makes the medical spa, and I'm making place for them to get their allowing them holistic approach, and has been providing incredibly outstanding result. And my journey is always very fulfilling to establish this place for where patient can come and get the natural radiant result. Also they got the customized personalized treatment.
Thank you so much for sharing that, Dr. Patel. Isn't that incredible that, beauty and science go hand in hand? It's truly inspiring that your foundation in healthcare evolved in something so deeply personal and empowering, helping people not just heal, but feel confident in their own skin.
Absolutely. Yeah.
Yeah, and your journey reminds us that it's not about only outer appearance, but it's also about feeling seen, cared for, and understood. So now let's dive into the conversation we've all been waiting for with Dr. Patel. Our pageant sisters have a question that do not just reflect their own concern, but also shows concerns of women all across the US. We have with us Rashmi Nair, our reigning Mrs. Universe USA petite. Rashmi, please go ahead with your question.
Thank you, Pallavi, and so nice to meet you, Dr. Sunita Patel. So my question is mostly the most common problem that we all women face, and that's acne. So we all have had it as teenagers. We have had it in our 20s, in our 30s, during pregnancy, after delivery, in our 40s. I know many women struggle with it. Women across the world, I would say, have had problems. So what it leaves is the scar. And that is pretty terrible to hide with makeup and everything. Every day it reminds you of those, unnecessary part of your face that you don't want. So what, according to you, is the safest way to kind of reduce or kind of erase the scar altogether?
So thank you for a lovely question. The acne scar can often worse than outbreak. But nowadays is possible to get better treatment, and over the time it can fade up and make your skin smoother. So that's basically you use the daily treatment like medical grade creams with combination of the treatment. So such as vitamin C, retinol, tretinoin, use that daily. So that's peel off your superficial layer. And at the same time, if you combination of the medical grade in-office treatments such as chemical peel, microneedling, and laser, that toply highly rated medical grade FDA approval laser is Aerolase Neo that I'm using, and it has an amazing result because it stimulates the collagen. So over the time, like you see, you need a multiple session depending on how stubborn and how deep your acne is. So over the time, you see the collagen stimulation and microneedling also helps you. Collagen stimulation, laser helps you, and chemical peeling take up superficial layer. So over the time, you see that your scar is getting smoother, your skin looking brighter and more glowing and radiant. In a stubborn cases, there are some worse cases. They have a deep acne. They need a very strong medical, prescription creams, and also multiple session with the in-office treatment that I told you about, like microneedling, laser, and PRP. That all combination can achieve the best result. And over the time, you can see that acne almost fade off or is gone.
Okay, cool. Thank you so much for the answer.
You're
But
welcome.
I'm gonna go try because I have a lot of scars, so
Please,
probably one day.
yeah, please come when you come in New Jersey.
Sure, thank you.
You're welcome.
That's so sweet of you, Dr. Patel. And what if, like, we are hoping for quicker results? I did hear your solution over the time that we have to apply some specific creams that you mentioned. So, how about, often we all women want quicker fixes. So, how
So, acne can be very stubborn, and everybody wants to get quicker, result, wants to get their face nice and radiant, smooth, glowing, because it's very annoying, very um, uh, like very affect your confidence, going out, showing up yourself. So that's everybody wants the quick result, but we always have to put the priorities of the safety. Safety comes first before any treatment, and that was the medical and science take the part in the aesthetic area. So we always go safe, evidence-based treatment with prescription cream and treatment. So it can take time. You have to be in a patience, but the safety and skin health is always priority. So that was you can do like without even do the treatment session every 2 to 4 weeks over multiple sessions to achieve the best result, but do not harm your skin and make sure that your skin healthy and glowing.
Oh, that makes
So,
sense.
so there is no quick fix. Is always have a little time to every after treatment.
Got you, got you. Thank you so much.
You're welcome.
So next we have our Mrs. New Jersey Universe 2024, Divya Frank. So Divya, floor is all yours.
Thank you, Pallavi. And hi, Sunita. How are you?
I'm good. How are you?
Yes, I'm doing good. Thank you. And my question to you is about melasma, because melasma has been a stubborn issue, a skin issue for me, and it always comes back, especially, after being in the sun, which is unavoidable. Though I apply sunscreen lotion, it's of no use. I know a lot of women across this country is dealing with the same issue too. So, what is the best way to treat it so it doesn't keep reddening?
So the melasma is a very, very stubborn condition, and
Mm.
there is no cure. We can manage, we can control. So the minimum way to take care, it's like using everyday sunscreen. That's a minimum way, right? Also,
Yeah.
the melasma is affected by sun, heat, and also hormonals. So in a woman, even men, throughout the age changes, the hormones change. We are always under sun. We cooking, so always near the heat. So it's affect. So this is like combination approach again. You using sunscreen, you using medical grade, prescription treatment such as tretinoin, hydroquinone that light up your melasma, and you use like medical treatment like in-office procedure is a laser rejuvenation. That's also reduce your pigmentation and chemical peeling. So when it's a combination of both, you can achieve the result, but also you need to control. So our focus is not to only get rid of the pigmentation, but also control the pigmentation melasma and make sure that we continue taking care of the skin, avoiding sun as possible, avoid the extra heat unnecessary that you can, and also use sunscreen every day and maintain your melasma every few months once is under control. So you don't get the new melasma as stubborn and as often. So sunscreen is the key to reduce melasma and reduce the damaged skin from the environment.
Oh, thank you, Sunita. And about sunscreen, I use SPF 50. So what is the maximum thing we can use? Because I can see even SPF 100 in the market. So is it safe to use?
Yes. So SPF 50 and above is recommended. So
Okay. Okay.
most of the time people use, like, average people use somewhere 50 to 70, but they people have a mentality or believe that once they put the sunscreen, they're done for the day. That's not true. If you're going under sun or under beach or walking in a park, of course you sweat. So your sunscreen is wipe off. You need to use every half an hour to keep, like, protect your skin. And most 99% people don't carry with them once they leave their home, and we don't use that often when we are under beach or taking sun bath. So that's a gap that you can have. If you have a melasma, it can get worse. If you have a sunspot, of course it can get worse.
Yeah, I got it now. Because I don't use it like every half an hour. So we just apply it
So
and
especially
we
when you
go out.
whole day, yes, that's what you need. If you're not going under
Okay.
sun, you don't need that often.
Okay. Okay. Got it. Thank you so much.
You're welcome.
That's such valuable advice, Dr. Sunita. Thank you for breaking it down so clearly.
You're welcome.
Next, we have our reigning Mrs. Bharat Elite Texas, vKamna. Go ahead.
Thank you, Pallavi, and so nice to see you, Dr. Sunita. So I'm really obsessed with skincare for last few months, and recently I have started seeing fine lines, which I think is because of smiling. I like to think, and then also the dark circles under the eyes. It's because of the busy schedule and late nights. So I was just wondering if there is any cure for these two things, which we can, if we can smoothen the fine lines and brighten the dark circles. And I know a lot of women, throughout the world have this problem because of the stress, hormonal changes, etc., etc. So, do we have anything that can be, something like a quick fix, something that's real, that's not making the eyes look puffy or frozen? So, anything that you
Yeah.
can recommend?
So thank you for asking such a great question and common issue among all age. So fine line is one of the sign we all notice first before even we notice something, change in a skin, losing volume. The fine line, and it's most of the, as you say, come from the facial expression, smiling, and this is normal, right? But when it gets like at the point that it start bothering you, that's what you need to think about taking treatment. So nowadays is a good news that we have so many products to smoothen up your line and you still have a natural look, your natural expression, such as Botox, dye spot, right? That's like reverse, right? But if you want to looking something for the prevention, again, sunscreen is the key to avoid getting skin damage. The sun itself also damage your skin and help you, like, make your fine line stubborn. So that's another things that you can do. That also in office treatment is like chemical peeling, laser treatment, resurfacing laser, and also microneedling. So that stimulate collagen. It does not have a direct effect on fading off a fine wrinkle, but it does stimulate collagen. So the fine wrinkle get fed up and you look smoother and you still have a natural look, natural smile, and natural facial expression.
Awesome. Thank you so much.
You're welcome. As far as the dark circle under eye, there is the approach is depend on a problem, right? If it is pigmentation, we can give prescription fading off cream, brightening cream, uh, laser, chemical peeling. That's if they have a pigmentation. If they have a volume loss, that's another problem, because volume loss also make you feel hollow and also darkness. So most of the time we go over their genetic history, family history. If family has a grandmother, mother, brother, sister has a hollow eyes, that always look darker because there is no volume. So a lot of young people born with that and they have nothing done wrong, but that's way they are genetical. So that's a two different approach. So if you have a pigmentation, is a pigmentation treatment, as I say, chemical peeling, creams, and a laser treatment to reduce the pigmentation. If you have a hollow eye or volume loss, that was adding another treatment, like, nowadays the filler, very safe filler to use to fill up your hollowness. So it's make you look like a rested eye. It doesn't look any puffy or anything. That's one of the quick fix. But if you want long-term result, that's a PRP, which one I draw the blood, separate your plasma. It has a multiple name: plasma, stem cell, collagen, PRP. So that inject under your eye and stimulate collagen, improve a lot of vascularity, make skin, firm and like even out, toning and structure. And over the time, it takes about 6 to 8 weeks to stimulate collagen. So over the time, you see your hollowness get down, your skin looks brighten, and it looks nice and firm. So it depending on the approach is depending on the problem.
I see. Thank you so much. I'm going to learn more about it. Thank you, but that's a great help. Thank you.
I am sure this is a lot of technicality for us because, of course, we don't come from aesthetics background as you. So I have a quick question in here. So as we were discussing about dark circles, right? So as you said, it could be because of, I think, loss of volume or pigmentation. So is there a trick or a hack wherein we can kind of implement it and know why it is happening? Is it the pigmentation or is it the loss of volume? How exactly do you know?
So the pigmentation you can see clearly. And when you use the, prescription medical grade brightening cream or chemical peel or laser, you see the improvement start. If it's hollowness, you don't have a volume. And a lot of people has a genetic problem. I do see the 12 and 13-year-old, girl, the parent brought them because they feel so much, isolated and peer pressure, and friends make fun. So they brought here and I do the PRP. But because of they are so young and their blood has a lot of growth factor, so they are like need one session once a year and they're good. Versus somebody older, 50 years, 60 years, they have a volume loss because of the age. They need multiple sessions. And because of their age, their aging is super fast. And we're trying to hold the age and bringing back in 10, 15 years younger, or replacing a lot more volume. So if they stop maintaining, then they go back where they were. So after initial treatment, they have to come back depending on their age, their skin condition, their genetical history, their volume loss. So a lot of things affect. So every treatment is personalized based on patient needs.
A lot of things we need to learn. I mean, I am from an IT background, and of course, if you ask me anything IT, I'll be able to answer. But of course, if we want anything around aesthetics, we need to go to you for sure.
Please reach out.
Okay, thank you, Dr. Sunita.
You're welcome.
Next is Mrs. Universe USA runner-up 2025, Divya. Please go ahead.
Hello, Dr. Sunita. How are you?
I'm good, thank you. How are you?
I'm doing good too. Thank you so much. So, here is my question for you. Years of enjoying outdoors have left me with sunspots, and they just don't fade away. I know I'm not alone in this because women across US have been facing this issue since long, and they are continuously dealing with it. So, what's the best way to fade the sun and the age spots while maintaining a healthy and a natural glow? And this question is not just for me, it's for all the women across the US who are going through the same thing since long. So,
Thank you for a nice, informative question. And this is the common problem on all ages. Because when we are young, we don't realize or we don't appreciate what we're going to face is what we're enjoying right now. So after enjoying many, many years suns and outdoor activity, you do see as you have years passing, you see sunspot, aging spot, because sunspot is come from the radiation, sunlight, and also it makes your skin damage. We call environmental skin damage. If you it's not only the sunspot, but also other area also skin damage. So this one we can manage by medical grade prescription, local treatment such as brightening skin, pigmentation, hydroquinone, tretinoin, retinol. That all we can use it, and also medical grade. We can use like laser, light based laser, resurfacing laser. It is controllable. it is avoidable. If you use every day after taking multiple sessions, we can control that pigmentation, sunspot, aging spot. But if you go back and don't maintain, or you go back same outdoor activity under sun, you can get it back. So it has to be like, maintain as well as use sunscreen and avoid sun as possible.
Thank you so much. That really helps. And I'm looking forward to seeing you and discuss in detail. So,
Thank you.
thank you.
That was again so informative. I know I cannot stop myself complimenting you because the way you are explaining it is so properly broken down. So very nice. And I also want to say our queens do not just wear crowns, but they also carry questions of women, all across. Because I know for sure, because I am also a woman, we have so many questions going on in our mind, and you guys are asking all the apt questions. So
I'm
yeah.
happy to answer all the questions.
Yeah. So next we have our Mrs. New York Universe 2025, Nicole. Please go ahead. Nicole, I think you're on mute.
Sorry about that. Hi, Pallavi. Hi, Dr. Sunita.
Hi,
Thank you.
Nick. How are you?
Good, thank you. How are you?
I'm good. Thank you.
Good. So based on also my career and everything, going on every day, I've noticed and spoken with a lot of other women as well about this, and noticing that sometimes the face is losing some of its natural fullness, doesn't look as bright anymore. And then also like, putting that makeup on almost, every day for me, since I'm also a model and we have to look pretty. I know that other of my friends and, other models and beauty queens are wondering the same thing. So what would be the safest way to restore the facial volume so that the face looks more fresh and not overdone, and it restores the natural fullness to it? And, we all want to look our best every day.
So losing face volume is a natural part of the aging. No one can avoid, but we can, slow down that by maintaining early in age that we call preventive. So when you start taking care of yourself early in age, your aging goes slow. So that's one of the, best benefit. So the face volume is like, you're losing good fat, collagen, and also elasticity. So your face looks like dull. New term is a bitchy face, that, new term that people says, even though you smile, but you don't look like you smile because you lose your volume and your skin looking dull and no elasticity, or you look the good fat. So that one can be done like, quick fix is a filler. There are so many different filler. There are safer filler. There are cheaper to high-ended filler. That different type of the filler you can use it. The long lasting, it's depending on what type of the filler you use it. So it can give you quick fix. You walk out with nice and full or your face. The long term and safest way to use the PRP. Again, the PRP is like evidence-based and more popular, becoming almost every field in a medical section, like in aesthetic or surgery or dermatology. So this is like PRP is again separating your stem cells, putting back in under your skin, giving like 6 to 8 weeks to stimulate collagen. Need a 3 session in initially, every session month apart, and then you need a maintain. You see is a long lasting result. It does not take away your natural look. It's just make you look 10-15 years younger, depending on volume loss, skin care, lifestyle, how much skin damage. If you are doing outdoor activity and you always under sun, of course your skin has a lot more damage by environmental and sun. So it's a lot of factor effects. So this one is like you do 3 sessions, you maintain every 6 to 8 months, and you can be keeping yourself, 20 years younger. And I do have some pictures there. So you can see that one of the pictures is a doctor, works in one of the medical field, primary care. And she's my patient for last 4 years. And she did a 3 PRP with laser rejuvenation. So she did a first year 3, then she came back 6 months. She wasn't too happy because she wants to look 20 years younger. Everybody has a separate goal. Everybody has an expectation, whatever they feel comfortable. So that following year, she did a 6 every 2 month one, and she achieved that result. Now she does not do anymore. She comes once a year. So once you achieve your goal, then you just maintain as a one every 6 month, 8 month, 1 year, depending on your how good result you want. So this is the like long lasting. So there is a quick fix, and this is a safer and long lasting.
Wow, thank you for that. That's very, very helpful. Now I know exactly how to address the issue and what to tell my friends as well. And so this treatment would have to be done at the beginning. You would recommend once every few months?
So this is the same treatment is we can call preventive and corrective. So preventive, if somebody 30-year-old feel like say, oh, I feel like a little wrinkle, I have a little under eye volume loss, or my skin start looking dull, and we do the one session because 30-year-old has a lot of growth factor. Her blood is very healthy, very highly nutritious versus somebody 60-year-old. So she take the one session once a year and she can maintain her look versus somebody 50, 60-year-old, their growth factor is going down. Their blood has not as nutrition compared to younger people. So they need more often and more session. So that we call corrective. So if nowadays is new trend that if you start your taking care your skin early in the age, you pushing your aging 10, 15 year back. And you don't need to work harder to maintain your look in your early 50s or 60s. So that's a new trend. People comes like, preventive Botox, preventive, PRP, microneedling. So this is new trend younger people looking for.
Thank you, Dr. Sunita. This is great information.
You are.
Can't wait to definitely come and visit you.
Sure. I'm here for all of you.
Amazing. Thank you.
Okay, a big thank you to all our amazing queens for bringing forward such insightful and relatable questions that all the women, I'm sure, across the globe wanted to get answered for. And even bigger thank you for Dr. Patel for taking the time to share her. This has been so insightful and empowering conversation. And I know for sure all the women across the US are going to benefit from it.
Thank you, Pallavi.
Yeah. So, okay, Dr. Patel, we have picked your brain on all things beauty and skin. Now it's time to see your fun side. Let's dive into a quick rapid fire round. Okay? Just your first, no overthinking, just your first insight.
You got it.
Okay? So I'm going to ask you, throw these fun questions on you, and you have to answer in a few words or a sentence at max. Are you ready?
Let's go.
Okay. So one skincare myth you wish people would stop believing.
I think people think more product use is more better skin. You don't need to use more product.
Got you. Mm-hmm. Your favorite ingredient for glowing skin?
Vitamin C. You never go wrong.
Is it?
Yes, it's brightening your skin, protects your skin, and keep healthy.
Beautiful, beautiful. Most underrated skincare tip?
Using consistently daily sunscreen.
Mm-hmm. What makes you smile at work every day? Let's change the topic from skin, beauty, about you now.
When I see my patient, they feel confident on their own skin. That makes me feel so happy.
That's the real happiness, right? The kind of work you're doing, that is what our happiness at the end of the day. Beauty. One word to describe millennium skin and laser, your med spa.
Empowering.
Yeah, you are for sure empowering women. Okay, that was so much fun. Thank you for playing along and letting us see your lighter side. And of course, sharing your expertise along the way.
Thank you.
So before we wrap up, what is the message that you want to give to all the people who are viewing this group discussion of ours, who are unsure and not confident enough to take that step to go for these aesthetic treatments that we just talked about?
Can you repeat the question? I'm sorry.
Okay. I'll repeat that. So, what is your message? What do you think you can tell all our viewers who are watching our show tonight and who have never tried any of the aesthetic treatments? You know,
So I want them to, get the consultation first and learn about the treatment, gain the knowledge, and change your daily care, and just be consistent. Use your moisturizer, use the good, you don't have to be expensive, but use your moisturizer, use your cleanser, and vitamin C. You never go wrong.
and that should be enough. I mean, if you're doing it dedicatedly, religiously, on daily basis.
Yes.
Oh, okay. Yeah, I know. Even I wasn't aware because when we were small, right, our parents did not know a lot of things around skincare. But now that I know, yeah, we are learning. These are the things if we can inculcate in our daughters or even sons for that matter, right? They'll go a long way, right?
Yes.
Okay. To all our viewers, if you're ready to elevate your skin journey, check out Millennium Skin and Laser, based out of Clifton, New Jersey, or follow them online for expert skincare tips and transformations. Dr. Patel, thank you so much for being with us. And to our beautiful pageant sisters, thank you so much for sharing your insights and curiosity. Until next time, keep growing inside and out.
Thank you so much. All of your pageant sisters.